Hello, my name is Christina McRae. I'm a student physical therapist assistant from Jefferson State Community College. Today I'm going to be talking to you about my treatment plan for thoracic compression fracture. My patient is a 65-year-old postmenopausal female that was referred to PT for treatment of compression fracture. A compression fracture happens when there's too much shear force placed on the vertebral bodies. With my patient, this happened when she was performing a twisting motion. Most of the time, the healthy bones of the vertebrae can withstand this pressure, but since she has osteoporosis, the weakened vertebral body could not withstand the twisting motion. So to understand compression fractures, we have to understand a little more about osteoporosis. Osteoporosis is a progressive disease that causes the bones to be brittle and weak. So I have a picture of a healthy bone right here, and then I have a picture of an osteoporotic bone. When a person has osteoporosis, the osteoformation is greater than that of the osteoblast formation. So the osteoclast that breaks down the bones is happening a lot faster than the osteoblast that builds the bones. So here's a picture of a thoracic compression fracture. Here's the anterior part of the vertebrae, and you can see this is a healthy vertebrae right here and how it's kind of even on all sides. And then here is a thoracic vertebral body that's been compressed, and you can see how it kind of wedges on the anterior part. And this is most likely from her being in a kyphotic posture with the spine being in a forward flex position. Okay, so I'm going to perform some soft tissue mobilization on my patient. This is Miss Rutledge, and I have chosen to do a pec minor elongation with muscle bending. It's going to help to release that pec minor that's keeping her in the kyphotic posture. Okay, so what I'm going to do is just get a little bit of lotion, and I'm just going to start out and I'm going to warm up her tissues. Now, since she has been in this posture for a long time, these pec minor muscles are going to be really short and really tight, so you have to go kind of easy. But your patient has to understand that soft tissue mobilization is not a massage. It's not meant to feel good. You know that it can be a little intense at certain times, but you do need to make sure you're working within your patient's pain tolerance. So right now I'm just kind of trying to elongate or just warm up the tissues. Okay, so now I'm going to do some tissue elongation. Okay, you doing okay, Miss Rutledge?
I am. It's tight.
I'm searching the fibers for any tightness, any adhesions or restrictions. Typically this treatment would last about 10 to 15 minutes depending on how long that it would take to get her muscles to relax. I would definitely work both sides to keep her even. Okay, so now I'm just going to do a little muscle bending. When you're working in this area, you need to be careful of all the neurovascular structures that run through the axilla, so you want to make sure that you're not compressing any of that. Be careful of the lymph nodes in this area. And I'm just working from the ribs towards the coracoid process. Just kind of smooth it out. You also want to check with your patient to make sure they're not feeling any numbness or tingling in their hands. If they're feeling any numbness or tingling, that means you're on a nerve, so you need to move. Alright, done with that. So next I'm going to teach my patient her home exercise program. For this particular patient, I've chosen isometric shoulder retractions. She is having a lot of deep, sharp pain in her thoracic spine, so I went with isometrics because we don't want her to do any dynamic strengthening yet. Okay, so let's move over here. Okay, Miss Rutledge, so today I'm going to teach you what we call shoulder retractions, and what that's going to do is that's going to help to strengthen these weak muscles that you have here in your back, okay? And it's going to help you to pull your shoulders back. So first what you're going to do, and just watch me first, and then I'll have you do this, okay? So you're going to try to pull your shoulders back as much as possible, your arms bent to your side, and you're going to pull your arms back, and you're trying to bring your shoulder blades together, okay?
Okay.
So I want you to try to sit up as much as possible. Let's bend your arms. And so now I want you to try to, we're not going to do this as hard as you can, okay? Just kind of nice and easy. Try to pinch my fingers. Okay, I want you to hold it for 3 seconds. 1, 2, 3. Relax. We're going to do this 6 times, okay? Let's squeeze together. 1, 2, 3. Relax. Are you having any pain or anything?
Nope.
Okay, let's squeeze it together. 1, 2, 3. Relax. Got 3 more times. Squeeze. 1, 2, 3. Relax. Okay, one more time. 1, 2, 3. Relax. Okay, doing okay?
Yep.
Okay, one more time.
Okay.
Squeeze together. 1, 2, 3, and relax. Okay. I'm gonna have you do this. You're gonna do this 6 times a day, or 6 times twice a day. Okay.
Okay.
A couple things. If you're having any pain, I don't want you to do this exercise. And if you start feeling like you're fatiguing before you make it to 6, it's important that you stop. We don't want you to fatigue those weak muscles that could cause you to come in a more forward posture like that, okay?
Okay.
Do you have any questions or anything?
No.
Okay. I do have a home exercise program that I'm going to give to you so you can take this with you. It lays everything out for you.
Okay.
Alright, so what I'm going to teach you next, I understand that you're having problems getting out of the bed by yourself, that your husband is having to help you go from a sitting up position to being able to actually to get you out of the bed.
Mm-hmm.
So I'm teaching my patient a side lie to sit transfer, because we want her to avoid flexion of the spine, because that's going to cause more compression of that vertebral body. Okay, so what I'm going to have you do, I'm going to demonstrate, and then I'm going to have you do it again. So you're laying in the bed. I want you to bring your knees up, roll over to your side. You're going to push up and come up on that elbow, and then you're going to swing your legs off, and as you do, come up. I want you to try to keep a straight spine, no twisting or anything like that, since that increases your symptoms, okay?
Okay.
Any questions or anything?
No.
Okay, so I'm going to have you come over here and lie down.
Okay.
Okay. So let's bring these knees up. Let's roll over to your side. Now let's bring that elbow back. Now push up as you're swinging these legs off and try to keep from twisting your spine. Okay? How'd that feel? Any pain or anything?
No, not at all.
Okay, so anytime that you go from a lying down position to getting up, I need you to stand up like that, okay?
Okay, I can
All
do
right.
that.
All right, thank you, Miss Rutledge, for your treatment session today.
Thank you.
Okay. Okay, so I feel that my patient's prognosis is good. I do not feel that she will return to her previous functioning level before her injury due to the comorbidities of the osteoporosis and then her age. She has an appointment with her medical doctor in a couple of weeks to be fit for a spinal orthosis. I believe once she gets her orthosis, it's going to help her maintain extension of the spine, and she's going to be able to perform all her ADLs and day-to-day activities without any pain. That concludes my treatment session. Thanks for watching.